Welcome to Korean Help's Mental Health Awareness and Wellness Podcast. In this podcast, we discuss various topics regarding the Asian community, whether it be through professional interviews or group discussion. We want to emphasize that our podcast is aimed to be a safe and comforting space to all, where we can all share our thoughts and learn about vulnerable topics. Please feel free to give us any suggestions or advice for future episodes, and we hope you enjoyed today's discussion. For more information about the initiative behind this podcast, mental health resources, and other medical services, please visit koreanhelp.org or email info@koreanhelp.org. To first introduce ourselves, my name is Hannah.
My name is Daniel.
And my name is Angela.
Hi, I'm Chloe.
And I'm Faith. Today we are joined by a special guest, Miss Angela Park. She majored in psychology with a specialty in sociology at Stony Brook University and later specialized in mental health at Columbia University's School of Social Work. Today's discussion will highlight important aspects of mental health as we gain insight about Miss Angela Park's experiences and expertise. So to begin our conversation more about your background, I'll hand it off to Daniel.
All right. Hello, Miss Park. First of all, I just wanted to say thank you so much for coming here, for being a guest. We're really glad to have you. Yeah, so before any of the very psychology-related questions, we just wanted to know like your general background and like what were the main things that like led you up to being pursuing psychology? Yeah.
Okay. Oh, nice to meet you, Danielle, and thank you for having me. So what led me to pursue in this career is, I guess I want to say my deep value for like listening and understanding. And active listening helps people to understand their intentions and behaviors, right? And I believe every behavior communicates something, even though it does not necessarily mean it's always effective. And understanding the intention of the behavior can help us to make a decision whether we want to make the different action in here or not. So with some more awareness and efforts, meaningful change is possible. And in the therapy room, I think this is a space that we can make the change. And that's why I want to, I pursue this career and what I value in my work.
I see. So what you're talking about is like mainly like psychotherapy, right?
Yes, yes.
So that's the specific type of psychology that you were studying, right?
Yes. Uh-huh.
I was just wondering what makes psychotherapy more different from the other fields like of psychology? Could you talk about that?
Okay. So other forms of therapies like, physical therapy or occupational therapy, they target physical function, right? But in terms of psychotherapy, also known as talk therapy, it is different from this type of therapy in a sense that we mainly focus in emotional and psychological difficulties.
I see. It's like the very popular view of like what people think of like what therapy is, right?
Yes.
Nice.
So yeah.
Okay. How would you like describe your job as a psychotherapist specifically, especially working at a university?
So my job, so I want to say the role of the psychotherapist can be various. So sometimes psychotherapist can be an educator. So I educate patients about mental symptoms, prognosis, or the treatment methods, and some type of skills, right? Like could be coping skills, communication skills, based on my knowledge or education or research, right? And having this knowledge, it allows the people to make more informed decision in their treatment and like any decisions in their lives. And it can also make people feel more understood, which make also people feel more sense of empowerment. And another role of psychotherapist, it can be supporters in general. So I can provide unconditional care and support for who they are, not what they've done in their life or what they've achieved. So I encourage people and motivate them to achieve new things or try new things. Sometimes therapists can be advocate for patients, families or communities to promote mental health well-being, also to increase the awareness of mental health. And we also fight for like destigmatizing mental health challenges. So I want to say therapists can wear many different hats based on their needs, people's needs.
What kind of method of therapy do you most commonly use with your patients? Just curious.
So before I say, what kind of method I use, I want to talk a little bit more about, what talk therapy is. And then I'm going to go into that. Is that okay? Okay.
Yeah.
So basically, talk therapy, we mainly use verbal communication, right? So, by using verbal communication, we help the individuals to have an opportunity to explore and observe their thoughts, feelings, and behaviors. And it helped them to have more new insights. And as we develop new insights, people might feel more motivated to make the changes in their life or make different decisions, what skills or what area they need to learn, unlearn, or relearn. And we help the people to practice new skills and generalize the new skill. So therapists can be trained in a specific types of treatment modalities like CBT, cognitive behavior therapy, or DBT, dialectical behavior therapy. However, in my case, I basically employ CBT or a more trauma-informed therapist. So I use something called EMDR, eye movement, desensitization processing, reprocessing therapy.
I see. That's very interesting. Thank you for sharing. I will leave it to Hannah for the next session.
Yeah. So now that we know a lot more about your backgrounds, we kind of wanted to learn about not your clients, but the cases that you've observed and the way that you treat these patients. So first, regarding the various people and the various age groups that you've worked with, I was wondering, especially in terms of age groups and the different people that you've worked with over your career, have you noticed any patterns or common challenges that they were facing and how they were correlated? For example, younger students may have more academical stress or even familial issues, which are just ranged upon any age group. But have you seen any specific patterns or noticed anything throughout working with your clients?
That's a really good question. So the majority of my work experience was at adult clinic. So I have worked with young adults and people in their 20s and 30s. However, when I was working at an Asian community health center at Charles B. Wang, so the youngest patient was around 6 and the oldest was 86. So basically, I had an opportunity to work with people at any age group. So from my experience, like children and teenagers, like usually the main stressors are definitely academic stressor, right? And friendship or conflict with their parents. So the academic stressors, it might be coming from the pressure from the parents or themselves. And the students, they might have some more strong belief that, okay, I should be perfect, for example. Then sometimes the perfectionism can result in anxiety, depressed mood, overwhelming feeling, or sometimes, unfortunately, sense of inadequacy or procrastination. And for those who experience the transition from high school to college, and they struggle with the transition because it seems like it's very first time for them to experience what it is like to take the full ownership in their lives, right? And it could be pretty anxiety inducing. For those in their 20s and 30s, they might also struggle with relationships, and they may also go through a lot of transitions, such as job hunting, job searching, like maybe like marriage, buying the first house, and it could be huge life milestone, and it's a giant burden on their shoulder. Maybe in their 40s, 50s, they may struggle with relationships with their children or spouse or some medical conditions like menopause. And people in their 60s and beyond, they may struggle to find a meaning and new purpose in their life. Even though it seems like people tend to deal with different types of stressors depending on the stages of life, how it might be presented could be similar, but at the same time different. So it might affect the lack of energy, right? or lack of motivation, feeling anxious, feeling depressed, low self-esteem, maybe self-critical thoughts, sleep disturbance, social withdrawal, isolation, or hopelessness, sometimes, unfortunately, like suicidality or homicidality. Interestingly, what seems to help mitigate these experiences or symptoms is their support system, like relationships with their loved one. Any relationships like friendship, romantic relationships, family relationships, marital relationships, any type of interpersonal relationships can be a great protective factor for mental well-being. However, unfortunately, the people that I've met in the therapy room, they have some experience being hurt by their loved one, and they end up being more isolated, distrusting people, mistrusting people. Sometimes they self-doubting or self-blaming. I think this is the correlation.
Yeah, I think based on what you've said, a lot of patterns are related to transitions and relationship problems, which are actually very relatable amongst a lot of people.
Mhm.
So, yeah, and also since you're working under NYU Langone right now, you said, and obviously you've had different situations before, different occupations in the therapy field. I was wondering if your experience under NYU Langone, where you're working with more younger adults, is any different than your previous experiences where you weren't affiliated with an institution.
So at this moment, I'm not working at a university, even though I am working at NYU, but I'm still working at an adult clinic. So under NYU Langone, I'm providing the service for the NYU employee or their families or some corporate people. So all of my patients are adults. However, what's the difference is because like teenagers or younger generations, they have different stressors like academic issues or family conflicts. However, with more people in their 20s, they tend to deal with more responsibilities, right? As I mentioned in the previous question, I think that's the main difference.
Yes, just tying onto the theme of like age-related stress, that seems to be a big thing.
Mhm.
So, Chloe, do you want to continue on with this section?
Yeah, sure. So, changing to looking at immigrant experiences. So, with their experience as therapists, do you find that Asian immigrant patients have like specific struggles, and how do you really address the struggles that they have?
Yeah, there are many struggles. And I guess the first common struggle is role reversal, which children are expected to take adult responsibility. And in fact, it can be stemming from parents' limited English fluency. Immigrant parents are focusing more on settling down into the new country, right? So they have little time or they have limited opportunity to learn new language, which might lead to a situation that children have to take adult responsibilities. So for example, children sometimes have to make a call to inquire about the phone bills or any type of bills or some important documents. Then they might have to dispute or explain something if there's some issues. And if the children manages well, then parents may become increasingly reliant on the children and ask them to take the responsibility from there, and which can place a significant pressure and contribute to extreme anxiety for young children and teenagers. On the other hand, if the children make a mistake while taking this responsibility, then the parents may respond with frustration or criticism. So for children who are still developing their sense of self, these moments can be extremely stressful, and it may also lead to some internalized feeling of inadequacy or some type of emotional trauma. Another struggle is definitely language barrier, right? Parents can only speak Korean and children can only speak English. Then it makes sense why it's hard for them to communicate and understand each other at a deeper level, especially as a teenager. Not only with the cultural difference, generation difference, but also language difference. It can also lead to, like the emotional distance between parents and children. Sometimes miscommunication or misunderstanding might happen because of the language barrier, unfortunately. For example, parents might say, like, what can you do? Like, 네가 뭘 할 수 있겠니? Or, 네가 뭘 하니? Then children might interpret it, okay, I am useless. And receiving this type of message from the parents might be the most important people who are the most important people in their life, can be emotional traumatizing. And they might experience low self-esteem or fear of judgment, because how my parents perceive me could be also how other people view me, right? Which can also lead to, not only fear of judgment, but fear of disappointing others. Sometimes people, the parents might say, oh, I work hard because of you. And sometimes the grandparents might say, oh, you should be good to your parents because they work hard because of you. With good intention, definitely. However, sometimes the children misinterpret it, and it also might lead to feeling of guilt or excessive pressure. And as a result, it can also lead to some difficulty saying no, maybe unclear boundary, unhealthy boundary among the family members. Lastly, I want to say a lack of availability. Typically, immigrant parents are busy working, right? So they're not fully available. And even if they're home, they usually come home late from work or they're exhausted. The children, they know that their parents work hard, and the children, even when they have some problem or concern, they cannot turn to their parents because of some, parents are not available. Maybe they don't want to bother the parents. Then the children, they learn to be overly independent. They tend to feel like they need to figure things out on their own without asking the parents. And it might also result in pseudo-independence, difficulty asking for help, not only lack of physical availability, but also emotional availability. Patients are not fully available emotionally. So when parents say, I'm sad, the parents might question, like, why are you feeling sad? You should be grateful. You have food, you have a house, you have parents. Maybe, they might say, oh, I've gone through more hardship. So, it's nothing compared to what I go through. Then, parents, rather than comforting or validating, they might compete or invalidate the children's feeling. It may also lead to confusion about the children's internal experience or, feeling of inadequacy.
All right, so thank you for talking about the immigrant experience, and we've all spoken about like how you respond to different ages, but can you talk more specifically about what the differences are in working with clients of different age groups or even different backgrounds, like how teenagers and adults react differently, or how immigrants or second generation Americans react differently?
Basically, the adults, they choose to come to therapy voluntarily, right? They choose to come to therapy voluntarily, so they may have some more expectation for therapy or expectation for the therapist. So, sometimes they might do some research about their therapy modality or therapy goal expectation, so it's more clear. However, when it comes to teenage patients or immigrant children patients, sometimes they have hard time, or they are being referred by their counselors or teachers or physical care, PCP. So working with immigrant teenager, for example, unfortunately, oftentimes the parents have hard time accepting the kids are experiencing some emotional or psychological difficulties, right? So it requires a lot of psychoeducations, a lot of teamwork with the parents, so we can help the children. And maybe children have more feeling of afraid that disclosing all these things with the therapist because they are worried about their parents, and their parents will figure things out. So it requires a lot of more time and efforts and trust. Immigrant parents, immigrants, they have hard time expressing their emotions. Maybe it's because they didn't have opportunity to express their emotions as a child, or even to the point, when they're experiencing it. Sometimes, again, frequently they believe what they're experiencing is wrong, or I shouldn't feel this way. So it takes longer time to help them understand, what they're experiencing is valid, and validating their feeling, and just trying to listen.
All right. Thank you for talking about your experience. And I'm going to pass it off to Faith to talk more about your advice.
Hello.
Hi, Faith.
So with your job, so as many people know already that like being a therapist is like a very difficult job because you're constantly surrounded with like and being told with like stories of mental health issues and like traumatizing subjects. So for you, do you think that it's like a mentally taxing job? And like if so, how do you like take care of yourself and your mental health?
It's very rewarding job, right? But at the same time, it could be very challenging for sure. So as a mental health professional, self-care is not an option, unfortunately, right? It's a survival skill. Um, and which I'm very grateful. So how I take care of myself, self-care requires a lot of like physical health too, right? Not only mental health, but physical health. So I'm dedicated my time for exercising a lot. So I finding walking extremely helpful for me. So because every step I take, I feel so grounded in the present moment. So if the weather allows, I go for a walk, play tennis, running. If the weather doesn't allow, I go to gym. Another way I practice self-care is self-validating and positive self-talk. Throughout the day, I constantly check in myself and try to validate my experience in the moment. So, for example, when I notice myself feeling very anxious about XYZ things, then rather than telling myself, okay, why am I feeling this way? Okay, I shouldn't feel this way. Okay, it means I'm like not good, or like etc. Versus, I usually tell myself, okay, I'm feeling anxious. It's okay to feel anxious. I can handle it, and take 10 deep breathing, right? So I constantly observe what I think, what I tell myself, and try to validate myself and try to provide some more positive self-talk, which helps me to reduce my stress and emotional stress. And it helps me to gain more composure to think about how to cope with this.
So are you like using your own like therapy methods in order to like motivate yourself and keep yourself together?
Of course, of course. And I think this is one of the most important thing, because I'm that type of person that I need to see how it works so I can educate my patient, and I can tell my patient, okay, I've done it and it helps. And this is some difficulty when I was trying to do it. Oh, do you also experience it? Right? Then my patient have more motivation to practice it together with me. So I'm doing it on myself.
I see, I see. Also nowadays, like therapy is becoming like more socially accepted and like as a way for coping or like just integrating into your daily life. So, do you have like advice as in like so how would you know when it's like a good time to seek a therapist? Do you think there needs to be like a specific time or trigger at any point in your life?
Mm, mhm, mhm. Anytime, right? Anytime. But it's because I'm therapist. So therapy is not only for emotional support, but it's also for self-discovery. That's what I think. And essentially, anyone at any point in their life, they can benefit from therapy. I think, and it is very important that we should know that anyone can benefit from therapy. And the reason why I'm reiterating it, because among Asian Americans especially, many people are so-called experiencing so-called high functioning depression and anxiety, meaning that, they can get their work done, they function fine. However, when they still feel depressed and anxious without awareness. However, like to the point that when people need to seriously think about having the therapist or seeking mental service, it could be when they notice some changes regarding their sleeping or appetite, mood, energy level, motivation, concentration, or sometimes they have some suicidal thoughts, right? Then I definitely recommend that they start seeking the, service for sure. And when they also noticing some, impacts on their level of function, or they start feeling the stress about it. And if you are not depressed or anxious at an extreme level like this, and just like having an annual health checkup, right? Even if you're not sick, talking to a professional can help you increase your awareness about all these things.
And lastly, many students, as well as myself, are actually interested in your field for psychotherapy. So do you have any advice to students like us who are looking to develop a career in your field?
Yes. So first advice I'd like to give them is, again, this job, every job is very important and challenging, but especially this job because we serve people who experience mental health issue and experiencing some life difficulties. It's rewarding, but at the same time, it's challenging, and it requires self-care. So first advice I'd like to give is physical and mental strength, and it's coming from self-care. So sleep well, eat well, exercise, right? And make it as a routine, period. Second advice, trying to have a therapist. It's not because I'm a therapist, of course, like in a sense, yes. However, having a therapist can be a good opportunity to, understand the struggle on a deeper level. What contributed, your current stressors, struggles, why it bothers me, what's important for me, what values I have, and being, like putting yourself in your in other people's shoes, because if you are pursuing psychology or psychotherapy track, then it's a good opportunity to learn, what it is like. And understanding it, it's gonna help you have a better understanding of the process of the therapy.
Yeah, that was all really insightful. Thank you so much. This overall concludes our mental health awareness episode. In today's episode, we covered several topics regarding the importance of self-care and seeking professional therapy. And as we've learned today, psychotherapy is one of the various kinds of therapy that is used to counter these struggles. I honestly thought the idea of reverse roles and how the immigrant parent and the second generation born child, that dynamic and having such a strong responsibility on both ends, that was actually really relatable and I think was really insightful for a topic that aims to just highlight the struggles of the Asian community and to really hear them out. I also thought the idea of self-discovery was a really good way to think of therapy as opposed to just a solution to someone who's having a terrible mental health problem. So thank you, Ms. Park, for providing us with such insightful information, and thank you all for joining us. For more information about the initiative behind this podcast, mental health resources, and other medical services, please visit koreanhelp.org. Thank you.